that I try to convey to providers is that oftentimes, when patients are having a hard time, they seem withdrawn from us. That most of the time it doesn't have to do with just with us, and I think it's really important to keep our egos out of it as much as we possibly can and recognize that the interactions are not about us, but about our patient and what it is that they need most in that moment.
How can empowered provider-patient communication and relationships foster improved connection and healthcare outcomes? Let's talk all about it with podcaster, award-winning author, and physiotherapist Jennifer George right here in episode 360 of The Nurse Keith Show. Well, hello there. This is Nurse Keith. This podcast is always about you, your personal and professional development, your career, and the healthcare system as a whole. And I share education, ideas, diatribes, and informative interviews with some of the most inspiring people out there. I love having you along for this ride with me. And here's a special request. If you find value in the show, please consider becoming a patron at patreon.com/Nurse Keith to help cover the costs and keep the show going. We're well over 400 episodes now, including all the bonus episodes that have come to you over the years. You can pledge as little as $2 a month, or you can always pledge more to get some awesome stuff in return. So head over to Patreon, that's patreon.com/Nurse Keith. And you can also show your support by referring yourself, your dog, your friends, your colleagues to Nurse Keith Coaching for holistic career coaching. I've provided over 2,000 sessions to nurses and healthcare providers all over the country and the world. And if you would like to chat with me, email me at keith@nursekeith.com. And if you mention Jennifer George or the show, you can get 15% off your first coaching package. And to learn all about Jennifer, you can head over to nursekeith.com/the word episode and the number 360 to the show notes. And we are welcoming Jennifer George. And Jennifer, it's so great to have a fellow podcaster here. And you and I are even on the same network at the Health Podcast Network. And it's super cool to be podcasting brethren, isn't it?
It really is. I'm so excited to be here with you, Keith. I love your show. I love what you're doing, what you've been doing. And I'm just happy to be a part of it and grow the network, basically.
Oh, thank you. Yeah, and we're both big fans of Dan Kendall over at Health Podcast Network, and there's a lot of great shows over there, and yours is one of the really wonderful ones, and I'm so glad we're connected. And your whole thing is about communication, and you're a physiotherapist. That's what you're called in Canada for our American listeners and listeners in other countries. So you're a physiotherapist and you're an author and you're a podcaster, like I said, and patient-provider partnerships are what you're really all about. And how did that come to be like a real focus for you in terms of wanting those partnerships to really be built on like stellar communication?
I think, for me, it stemmed really from my personal story of caregiving to my father for more than 11 years. So, and it was interesting because when my dad fell ill, it was at the onset of my career of becoming a physiotherapist. And I witnessed his interactions over the years and ours as caregivers and as family members. It really changed the course of the healing at times for him and our outlook as caregivers. So it really, though, I have to say, it shaped my practice throughout my career. I've been practicing now for 14 years. And it wasn't until my dad passed in 2018 that I became so conscientious of that piece of my practice. We assume a lot of our skill comes from our clinical skill set and our competency. And we don't realize that the glue that holds all that together is really our ability to connect and communicate and create partnerships with patients and caregivers.
Yeah. And I'm sorry about the loss of your dad. I lost mine as well in 2020. And, it's one thing to be a healthcare provider, but it's another thing to witness your own loved ones going through the healthcare system and the ways in which communication can really enhance their experience and your experience
Right.
as a family member, and then how it can really break down. And what are some of the ways you feel really called to you that you were like, this could really be so much better? Was there a crystallizing moment, or is it just an accumulation of observations over time?
Yeah, it was definitely an accumulation. But if I could go back to when I was a student, so I was visiting my dad in the ICU. And I was about to graduate. I was just a few months away from graduating to become a physio. And my dad had been in the ICU at this point for a few months, and he was just about to start physio. He was just starting to start making some recovery, but his cognition was still an issue. And I'll never forget walking into the treatment room, into his room, and he was dangling at the bedside, and there was the physio sitting in front of him on a stool. And I could tell that the physio, like I could feel that the physio was super frustrated. And I could see that my
Mm-hmm.
dad wasn't really following. And I could sense and I could feel the frustration. And at one point, the physio turned to me and said, I need you to think like a physio and not like his daughter. What would you do in this case? And
Mm.
the implication there was that he really wasn't appropriate to be on the caseload at that point. And he proceeded to say, your dad's taking up the majority of my caseload time, and basically we're not getting anywhere. And it's hard to hear that. And in healthcare, the struggle is, how can we convey things that are difficult? But how can we do that with compassion still? And how can we do that? Because we do have to sometimes give bad news, but I think it was
Mm-hmm.
just not given in the right context. And I know the intention wasn't bad, obviously, but it was just out of frustration. And I do realize that now as a physio
Yeah.
working in hospital, how busy things are. And I understand that stress accumulates.
Now, if you were in the place of that person, if you would trade places, how would you have approached that situation? And you were feeling frustrated and you knew that maybe this wasn't the most efficacious use of time and resources, but you saw this hopeful family member standing there, like wanting her dad to get better.
Yeah.
So what's another way to approach something like that?
That's a great question. No one's ever asked me.
Oh
I'm
my.
just thinking about that right now. And I think I just would have been encouraging. I would have just said it's very early on. We don't know, if that was talked about. We don't know what the course of his recovery will be like, but we'll continue to check in and work with him, and continue to consult with the medical team about his appropriateness for care and things like that. So I think I would have,
Mhm.
I would have had a dialogue and a conversation about it. But it was an intense moment, and these things happen. These things happen. I think I'm so fortunate, as much as my caregiving and as much as seeing my dad go through his struggle throughout the years. I'm so fortunate to have witnessed both sides and to have been on both and to be on both sides, essentially, because I think that's only made me a more empathetic provider overall.
Mhm.
Yeah.
Yeah, and empathy is a huge part of it, isn't it? And
Yeah.
when people are in a vulnerable state, whether it's the patient or the loved one, we need to stay connected with our empathy. It's super important because otherwise we're really losing something so central to care. And a little empathy goes a long way, doesn't it?
Yeah, exactly. And it only takes a little bit of empathy to go a long way. And I have had students over the years, and most recently, a student said to me, Jen, I can't say, because people think that to respond in an empathetic manner, some people say that, you kind of say things like, oh, I understand what you're going through. And I think that was the student's impression of what empathy was. And he had said to me, I can't say that because I've never been through what they're going through. And for me to say that isn't true. And I totally agreed with him. And I thought it was brilliant that he had seen that and recognized that. For me, empathy is really about trying to understand. So it's not saying you understand, because we really don't understand what another person's going through, even if on paper it's the same suffering in a way or the same injury in a way. But it's just really just trying to be present and be with your patient, and conveying that you're trying to understand their perspective and their feelings and emotions and their thoughts around everything.
Yeah. And I think what you just said, like, I'm trying to understand. And I
Mm-hmm.
often find it's very efficacious to say something like, I really wish I could understand what you're going through, but
Yeah.
it's nothing I've ever experienced before. And I can only imagine what you're feeling right now. And that's very disarming to say that to someone, like to
Mm-hmm.
recognize that they're suffering, but just to say, I can't even imagine what you're going through and what you and your family are feeling. And the
Yeah.
person, I think when a provider does that, or any professional does that, um, there's a little letting go or that happens inside someone's body. They feel like,
Mm-hmm.
oh, this person actually sees me. And
Yeah.
once you feel seen, isn't that such an enormous part of communication? It's just for the person to feel like you see them as a human being.
Yes, totally. And I think those non-clinical connections are important. Those conversations, being genuinely interested in who our patients are as human beings, first and foremost, what their family situation's like, what they enjoy socially. I've had moments over the years where, another example that's in terms of being seen, I was working with a patient. I just met him for the first time, and we were conversing about what had happened. And he had kind of an undiagnosed weakness that was going on. And, when you're really fully present with someone, like you said, you see them and you're really with them. And I could tell that there was just something that was holding him back. There was just something that was a bit emotional there. And I had said to him, I said, I can tell that there's something else going on. Would you like to share that with me? Is there anything more that you want to share with me? And he had conveyed that his wife had passed away. It was the anniversary of his wife's death that same day.
Mm,
And
mm-hmm.
as a healthcare provider, you can't help but feel like that's a big part of the emotional, like that emotional pain was a big part of the pain he was also coming to the hospital with too.
Yeah.
And I think in a way for him that was releasing too, to share, because we were able to talk about that as well, and provide support for that.
Right. Yeah, exactly. And your mission, if you were
Mm-hmm.
going to describe your mission in terms of your awesome podcast and the conversations you have there and your book and the speaking that you do,
Mm-hmm.
what's the mission, and what do you feel like you're offering to the world? Like what's your big gift to the world right now?
My big gift and the impact I want to have is to ultimately improve communication between patients and providers, and just to help recognize how important that is to the healing process as well, just as
Mm-hmm.
much as any other clinical skill that we're often trained in.
Yeah.
Everything for
And
me
that's
comes back to
wonderful. And
that. Yeah.
yeah, yeah, that's a valiant and noble mission. And you just mentioned training. So,
Yeah.
in your experience and what you've gleaned from talking to people and doing the speaking and everything you do and writing, where are we missing the mark in our education? Because whether it's physiotherapy, nursing, medicine, what's not getting communicated? Speaking of communication.
It's a good question. I think that, for one, I think especially right now in healthcare and among all healthcare providers, that some kind of education needs to focus on the well-being of providers as well. Because a big part of what I believe in too, as a part of communication, is that we are a big part of that, and our physical presence isn't enough, and it's hard sometimes to, when you're losing a sense of yourself, or if you're feeling burned out, to fully be present with patients. And that's often the argument, right? That's often the objection, sometimes, to communicating, because it does take time to develop. And then
Mm-hmm.
the other would be to to give more attention to and skill training on interpersonal communication to improve the communication between patients and providers and how we can do that. I would love for one day to have students in my path who don't have to even touch a patient and just literally for a few weeks just like listen to people's stories and kind of take in that side of healthcare that we sometimes overlook when we're students and we're trying to just learn it all, right? We know we're being evaluated. So that would be really cool if we could just bring students in to just literally shadow and just get to know patients for who they are and have conversations and build their skills.
Mm-hmm. Yeah. And sometimes it feels like we should all have a chance at being patients because some of us are consumers of healthcare more than others. And we know what it's like to be on the other side of the hospital gown. And
So
then
true.
other people don't. Right.
Yeah.
And I mean, nursing is very communication oriented and I had some grounding in communication skills in nursing school, but definitely not enough. And I hope that schools these days are teaching emotional intelligence and relational intelligence and motivational interviewing and all those sorts of things. Did you experience any of that in school? Was it part of your education?
No, the only thing I remember was right at the onset of my schooling is we did a first impressions video, which was really a video recording of a simulated assessment and just kind of more the first impression behind it. And that was it. And I mean, that's one way of learning for sure is watching yourself on camera and your interactions. But I also think there's a lot of power to actually like practicing this in a real setting with real patients, with real people, you know, and I mean, obviously that would be ideal if that could happen. But other than that, for me, haven't had any formal training in my education prior, but post education, there's a lot of, and I'm seeing it more and more, and maybe because my eyes are just more and more open because I'm so invested in this, is that there's a lot of pockets of programs out there. And, you know, we all have a shared mission, but they're all just so all over, right? Like you don't know what's out there. And it's unfortunate that it's not standardized across all health education curriculum.
That's true. Yeah. There are people doing interesting things around communication. There's here in the States, there's Dr. Candy Campbell, who's a friend of mine, and there's Beth Boynton, who's a nurse. Both of them teach skills and techniques of medical improv.
Awesome.
And they use the improvisational model as a way to teach communication in healthcare. Have you ever come across medical improv in your wanderings around trainings around communication and healthcare?
Just by my own, like I'm a part of the EACH. So EACH organization, it's called EACH. That's the acronym. And I think they're based out in the UK. So I've watched like video simulation on there, and that's just myself though. So not actually being engaged and being a part of it, just observing and just watching people on camera and how they're communicating. But I haven't actually physically been a part of it.
Yeah, it's pretty interesting. And you familiar with the actor Alan Alda? Remember Alan Alda from MASH?
Yes, love his podcast.
Yeah, his incredible podcast, kind of about communication. It's called Clear and Vivid, right? And he talks to a lot of scientists, and he's really big in terms of the communication of science, like educating the public about science. But he's a very empathic person. He talks a lot about, you know, how do you communicate correctly? And he actually trains healthcare providers in the use of improv. So he also does that. So I'm glad you're aware of his podcast, and you'd be a great person for his podcast because you're all about communication. So I'll have to give Alan a call and I'll have him text you next week. Okay.
I would love that. It's funny you say that because I literally was on his website not that long ago. I had heard of his podcast a few years back. I've been following it since then. So, but yeah, that's funny you say that now.
Yeah. He asks these really funny questions at the end of his show. He asks the same 7 questions of each guest. And I've been pondering doing something like that on this show. And he asks questions like, how do you stop a compulsive talker? Or how do you tell someone they have their facts wrong?
Oh my goodness. And, I'd have to get back to him on those.
Yeah, so I'll get back to you on that, Alan. I'm not really sure. Just keep talking. Yeah. Yeah. And I wanted to ask you, when we talk about provider-patient relationships and communication, we can train providers, right? They can go to improv workshops, they can read books, we can show them videos, all that kind of stuff. What about patients? What do you know about, and what do you think about educating the general public, pardon me, about communicating with their providers?
That's also a part of what I do too. So I've spoken with a few organizations here locally, one of which was Crohn's and Colitis Canada. And I speak a lot about empowering patients to advocate for themselves, because there was a time in our journey where we felt quite disempowered, and recognizing that that's not something that you necessarily give someone as empowerment. It's more or less something you create for yourself, and kind of assisting and guiding patients, on the other side of the healthcare system to speak up for themselves, to find their voice, and just offering some guidance in doing that. So that's a big part of what I do as well. And as much as I am, a healthcare provider advocate, I'm probably even a stronger patient advocate. And that's just because I think it's just from my personal story that everything I do comes back to that. So, so that's one of the things I do is I help other patients also just find their voice. And that's also through their own well-being and just being an active participant in their own care, and knowing that they have choices, and that they can always ask questions, and and get the information that they need.
Yeah, I think we need sort of a university of healthcare communication for patients. I think it would be really wonderful to be able to really train people. Like, this is how you talk to your provider when they're stonewalling or when they're not being empathic.
Right. Yeah. It's quite amazing. Like, it's quite amazing how people don't recognize that they just don't have that they always have a choice, or that they can always ask, that the door is always open. And I'll never forget, there was a story, I was helping a patient and his spouse. We were doing like a car transfer education session, and they hadn't seen each other in a long time. He'd been away from home for a while and in hospital, and he was getting close to going home. And this was pre-COVID too, where when we used to do passes, we would send patients home on passes and trial things out. And so that's what they were preparing for. And she had no idea that, like, she could ask for that. Like, it was more or less something that we were trying to help prepare them for. And she said that she was like, I had no idea that I could just do that I could literally just ask if I could bring my husband home for a day or two. And it was something that she wanted to do, but just never asked until we had brought it up and kind of guided things along that way. And I just thought that was pretty powerful. It was quite emotional for the both of them. And
that's great.
It's just,
very important moments for patients to feel like they have a say.
Yes.
It's so important. And when we come back from the break, I want to talk about some of the ways in which you approach particular topics, like how to connect with patients who feel misunderstood. What do you do when a patient isn't feeling like they're being heard? And also about how training providers in communication skills can actually impact their ability to ward off burnout, and how to keep them more satisfied and happy in their work. So that's some of the directions I'd like to go after we take a break. Does that sound okay?
Sounds good.
Great. So y'all hang in there. We will be right back with more of Jennifer George in the second half of episode 360 of The Nurse Keith Show. So now we're going to take a pause for the cause for just a moment. please consider becoming a patron of The Nurse Keith Show, just like other awesome listeners who value the show so much that they want to give just a little bit each month to support the work we're doing here. When you pledge, you not only get the satisfaction of helping produce and support The Nurse Keith Show, you also get some pretty cool premiums and gifts from yours truly. Just head over to patreon.com/Nurse Keith to read all about it. That's patreon.com/Nurse Keith. And if you know someone who could benefit from career coaching with me, please consider referring them. And if they become a paying client, you'll receive credit for an hour of coaching with me. And there's no expiration date on that credit, so you can keep it in your back pocket until you need it most. And remember that you can refer as many people as you like and continue to earn those coaching credits. What an incredible deal. And please head over to nursekeith.com and sign up for my newsletter, which comes out regularly and brings you supportive messages, updates from my blog and my podcast, resources, and all sorts of other stuff. Remember, nursekeith.com, sign up for that newsletter, and you'll also get a free download from me as my gift to you. Anyway, those are my sincere asks today. So now, let's dig back into today's topic without further ado. And welcome back to the second half of the episode. Remember, the show notes are located at nursekeith.com/the word episode and the number 360. We're here again with friend of the pod and my new friend, Jennifer George. And Jennifer, prior to the break, we were talking about patients and empowering them and providers and communication and how I feel like we need to have a university for patients on how they can be more empowered and talk with their providers. But I wanted to ask you, when a patient feels misunderstood, when they feel like the provider's just not getting it, whether it's you or you're observing or whatever, what do you do to make a connection so that the patient then feels like you actually are kind of getting it then?
So if I'm in the moment with them, I'm really just kind of quiet and just taking it all in. I'm validating of how they're feeling. And if it's not about me specifically, and it's maybe another practitioner that they felt unheard by, I try to, I offer me following up with that provider to kind of reach back out with them if that's what they would prefer. Most of the time, it's more just they want someone to hear that they felt unheard. And one of the things that I try to do as a provider, and one of my missions, I guess you could say, is to see the unseen, to try to understand the misunderstood, and try to hear those who feel unheard. So it really is just about holding space for the patient to express their concerns, and then offering that follow-up if they would like me to follow up on that with them or for them, or giving them the strategies to do that, or the process to do that. And if it's one of the other things too, if, I try to convey to providers is that oftentimes, when patients are having a hard time, they seem withdrawn from us, that most of the time it doesn't have to do with us, and I think it's really important to keep our egos out of it as much as we possibly can, and recognize that the interactions are not about us, but about our patient and what it is that they need most in that moment. So there's a couple different perspectives there.
Those are good perspectives. And patients can, how would I say this? There are generational differences in communication styles. And what has characteristically been called the silent generation, the World War II or Eisenhower generation, who I'm thinking of people I know right now in their 80s or even 90s who, the doctor is the authority and you don't really question the doctor, and you don't really complain to or about the doctor. And younger generations have different communication styles. So do you think things are changing? And the generations are becoming more, what would be the word, assertive in terms of communication?
I would say so. I would say so. I still, I mean, I see a wide range of patients of different ages. And even
Mm-hmm.
my most youngest patients, not that long ago, I had a patient in her teens, like she was 18, I think. And previously had interactions with other providers where she was being delegated a lot to an assistant and didn't know that that was not something that she had to consent to, basically. So,
Oh,
and then came into our care and was recognizing that she was, working with me often as the therapist. And she said, I really didn't realize I had a choice. Like it's so
interesting.
interesting. And so I don't really know if there's, like, I know exactly what you're saying. And it's like the doctor's word is Bible, but in terms of interactions and the quality of the interaction, I don't know if they process it differently. I can't really say that there's a huge difference. Yeah.
Mm-hmm. Yeah, it's fascinating to watch.
Yeah.
And um, we also have the whole idea of, we have provider patient
Mm-hmm.
communication, we have provider provider communication, then we have provider administration
Yep.
communication, right? The executives and the managers and, all those other
Yep.
people. So when we hear about what I mentioned earlier, medical
Mm-hmm.
improv, that often has to do with provider provider
Okay.
communication. And one of the things that comes up a lot in nursing, and I know it's not just the United States, is bullying and harassment and intimidation
Mm-hmm.
and incivility, basically. I guess that's the big overarching term. Do you feel like, how would I ask this question? What do you feel like communication training could do if we were much more assertive about training our providers in terms of communication? Do you feel like that could really take a bite out of the, what we could call the epidemic of bullying and incivility and aberrant behavior in healthcare?
Yeah, I just find it, I've always felt it so ironic that in healthcare, it's, we're in a profession to serve others, to be there for others, but yet it can be so toxic, at different levels. And I really don't have the answers, but I would think that any type of communication training could be applied, interpersonally between providers as well. Just the basics of compassion and empathy and listening, and just working as a team, oftentimes as well. It blows my mind sometimes the stories I hear in terms of toxic workplaces and yeah, I speak a lot of like a little bit about that on my podcast, but I
Mhm.
really believe it deserves much more than that. Like it's like, where do you focus, right? Because I do think it's a big source of burnout for some people as well. And even, you can go as far as to say mental illness and things like that. I'm sure it contributes in some way.
Absolutely. And all the physiological symptoms of burnout and stress. And, we can't ignore the fact that we've been in the middle of a, historic pandemic.
Mm-hmm.
And,
Mm-hmm.
people have been under great duress these
Yeah.
last 2 years, right? So
Yeah.
you can imagine some of the communication breakdown that happens here and there, probably much more than we even realize, because of just the overarching zeitgeist of what's going on out there in the world. Do
Yeah.
you hear stories of how the pandemic has created um, extra or extraordinary communication breakdown because of the stressors?
I think it's kind of always been there, but yeah, I would say that I would think that it's more highlighted since the pandemic.
Mm,
I think the
mhm.
pandemic has shone a big light on what, um, what gaps there are, I guess you can say, in healthcare when it comes to communication and just, team communication, for sure. And I think it's a combination of our personal stress that we're going through and then having to keep it together to take care of others in the professional environment. And we're all coming together for that common goal, but it's easy to feel like you're also alone in doing that sometimes. I often hear from providers that it's so easy to look at another person who seems like they have it together and just feel kind of bad about yourself and feel like,
Yeah.
so people just kind of having those real conversations and just, again, those non-clinical conversations, I think is helpful for just connecting and recognizing that we're all just human. I really have a hard time with the whole healthcare hero thing. I've never liked it since day one. I
Oh,
thought it set us up for an impossible standard, and I'm seeing, and we're seeing that now, I guess you could say, even more so.
Yeah, I really have a hard time with it.
Yeah.
And I've been saying all along publicly, like, we can call them warriors.
Yeah, I love that.
Let's not call them heroes, because when we go with hero, angel, like angels and scrubs and all that, it's making them seem kind of superhuman or not human. So I think it's dehumanizing, even though it could be seen as giving someone this great accolade to say they're a hero.
Right. Yeah.
But I would rather hear warrior, because that's what people have been doing these last 2 years. And there's this big dust up out there in the US right now, specifically, and on social media, it's just been blowing up, especially I've seen on LinkedIn. And I don't want to get deep into this with you right now because it's another issue, but just along that hero line, nurses have been lauded and all these accolades, and heroes been lathered on nurses for the last 2 years. But now Congress is here in the States is looking at capping travel nurse salaries because they want to control costs. And, nurses are saying, well, actually, we're actually being shown what we're really worth right now. And there's lots of different arguments about that, but it comes down to, for me, to some extent of, what do we value in caregivers, and why do we value those who provide care to our loved ones and help them stay well or die with dignity or whatever, or what have you. And when we label people with words that sound hollow, like hero, and then we start to come from a critical place of them, like, oh, they're earning too much money. And that's coming from members of Congress who can make millions of dollars in consulting fees and have the best health insurance in the world for life. There's a lot of talk about communication. There's a lot of ire out there flying around because nurses feel like they're now starting to get thrown under a bus, and doesn't feel very good to people who've been slogging it out for 2 years,
Exactly. Yeah. And how can it? I have so much empathy for all providers too, because we're tired, legitimately.
Yeah. And what's getting communicated there when we're complaining about what medical providers earn when we're still in a pandemic? So, the communication happens all different ways. And sorry, that was a little diatribe, but those happen here on the show.
No, I love that.
Yeah, it's important. And I wanted to ask you one more thing about what I kind of glossed over a few minutes ago, which is provider administrator communication. So, there's the people who we call, bean counters, like they're the ones who watch the money, right? Or the ones who watch just the quality metrics, and they're not watching the humanity of the providers. So what do you feel could be improved in that area of communication?
I think transparency, I think collaborative approach is really important. Instead of this kind of top-down hierarchy, I think, and especially when it comes to burnout, because I know it's not just at the provider level. I know that, executives are feeling it too, right? So I get that. But we could come together for the common goal of minimizing burnout and minimizing moral injury and things like that. I mean, it also depends too on your level of safety and how safe you feel in your working environment when it comes to maybe one-to-one interactions. That kind of has its own place. I've always felt like if you could just have one trusted person in the workplace, then, that's super helpful and can go a long way, even if it's for mentorship or if it's for just letting off steam or just, being yourself with someone, right? But yeah, I think as a provider, that would be what I would want to see is more of that collaborative approach, because I think only providers can tell you what they need. And we're so good at just keeping it together for as long as we need to. And we're starting to see that people are suffering. And rather than us having to approach all of the time, it would be nice if someone said, tapped us on the shoulder and said, "Hey, how are you doing?" And then go beyond that and, have an actual dialogue about it, I think is also important. Because the other thing about that is, and I've been talking about this with some guests on my podcast, is we've been recording stats on burnout for so long, right? We've been seeing this trend go up and up and up for so long, and it's at its highest now. So where are the solutions? And, enough is enough. Like we have to be more proactive about this. So that's the only other way I could see it, is it has to be collaborative.
Yeah, it does. It does. And, I've heard of the odd administrator who will actually get into a hospital gown and like go through a patient's day, or be on the receiving end of care and see what it looks like from the patient's perspective, which is a really powerful thing. And definitely. I've also heard of medical students who are the same thing. They have to actually undergo procedures. They actually get wheeled around in gurneys. They have to, sit in a hospital gown and, kind of wait for the provider to come around. And, we can all foster empathy in a lot of different ways and walking in someone else's shoes. And we mentioned earlier communication training and burnout. And I know this is something you speak about, and how communication training can impact burnout risk. Like it can decrease the risk of burnout. What do you feel like actually happens there when we teach these skills? What are we allowing people to experience, and how do they actually decrease their level of burnout?
So it really comes down to like connecting and aligning with their work again. One of the big sources of burnout is, or core components of burnout, I guess you can say, is emotional exhaustion and depersonalization. And then also feeling like your work has no meaning anymore. And what's the point? And through communication training, we can help restore empathy again, and we can help to help providers be more autonomous in their abilities to communicate with patients, and understand that alone is one of the ways that we kind of empower ourselves again to have control and autonomy over our practice, is in those moments. And the more we can do that and collect on that, the better. But we also have to understand that there's a bigger picture there to burnout too. So that's one component, is focusing on the communication piece. And the research shows that it's reduced levels of anxiety in healthcare providers. But then there's also the piece of the inefficiencies of the organization or the system itself that also has to be looked at in combination. So there was some work done at the Cleveland Clinic, and that's kind of what they noticed is they looked at kind of where could we minimize the energy demands on healthcare providers in our everyday processes, on top of communication training and empathy training as well, and bringing that all together. But for me, it definitely is giving power back to the provider, in the sense that, yes, what you're doing is making a difference again, and training them to be more autonomous in their one-to-ones, I guess you can say, or in their interactions.
Yeah. That's important. Yeah. And And finally, I want to ask you, you wrote a book called Communication is Care, 9 Empowering Strategies to Guide Patient Healing. And that's available on Amazon, and we'll have a link in the show notes. And I wanted to know what's the main thrust and thesis of the book. If someone wanted to purchase a copy, which I highly recommend, and will encourage our listeners to do so, but what's the core, like the kernel of this book?
So the kernel of the book essentially is for healthcare providers to build and enhance their communication skills, because it really is a part of patient healing. And so in my opinion, and through this book, it's your communication that actually enhances your patient outcomes. So it really is the difference between a good outcome and a great outcome, a memorable outcome, for example, as well. Just one that really touches people's lives rather than just completing a task and just showing up.
Mm-hmm. And these 9 strategies are specific to healthcare providers and what they can employ in their relationships with patients.
Yeah. So a part of it is bringing yourself to the equation. So things like connecting with purpose, your integrity, reflection are all very powerful. And then how you can use those to then also convey empathy and compassion and empowering other patients and caregivers. And avoiding conflict. Conflict is a big thing as well. I shouldn't say avoiding. It's more like, in my opinion, preventing conflict. Often in healthcare, at least for me, I can see conflict coming from a mile away. And part of the book too talks about just kind of how to be more proactive about things that could be a bigger web of concern down the road.
Yeah, that's great. And I really encourage people to pick up a copy of the book and to share it with their colleagues. And if you're an administrator out there listening, perhaps, or a CNO or a nurse manager or a medical director, maybe you want to pick up, a copy for every employee and distribute it, and maybe even create like a little study guide or reading group or something. Yeah. So anyway, just saying, if you run a hospital with, 4,000 employees, pick up 4,000 copies of Jennifer's book and just go from there. Yeah. Yeah. We'll send a copy to Alan Aldous shortly too.
Awesome. Thanks, Keith. It was kind of cool, actually.
What were you going to say?
My dad's, it was kind of cool. My dad's surgeon came to my book signing, in London, Ontario, and he actually bought a couple copies and then brought them to the hospital. He had been retired since then, where he had worked at the transplant unit, and actually brought the book to the transplant unit, so that, because my dad's case was so complicated, and it was a learning tool, but it was also like, hey, there's a story here behind that. Great. So yeah, it's really cool to hear people's stories and to get feedback from providers.
Yeah, that's wonderful. Well, it's a great book, and you're doing really good work out there in the world. Your podcast is wonderful.
Thank you.
And people can find you on Health Podcast Network, right? Mm-hmm. Your show is there. And where else can they find you? jennifergeorge.co, is that right?
Yep. So you can connect with me there. That's my website. So you can subscribe to my newsletters there if you'd like as well, or simply contact me through there. I'm social media wise, I'm on all platforms, but I'm mostly present on Instagram. So my handle's at Best Obsessed with Jen. Yeah.
Best Obsessed with Jen.
Yes.
Right. And then the podcast is the Healthcare Provider Happy Hour. Yeah. So you can pour a drink or not, adult beverage or not, and show up and hang out with Jennifer and her awesome guests. So it's really a great show, and it's in my queue now. So I really appreciate that. And
thanks, Keith.
You mentioned that you wanted to offer, or you do offer, free 30-minute one-to-one mentorship calls for improving patient-provider communication.
Mm-hmm. Yeah, absolutely. I'd be more than happy to sit and chat and just listen to what you have going on and see if I can be a source of support.
Well, thank you for that. So people can email you or just go to your website and contact you through the website?
Both ways. So my email is jennifer@jennifergeorge.co.
Okay. Jennifer@jennifergeorge.co. Well, anyone listening out there, if you'd like to take advantage of that free 30-minute one-on-one mentorship call with Jennifer, please do take her up on it and let me know that you had a conversation with her. It'd be really wonderful. And Jennifer, you're awesome. And I'm so glad we're together on the Health Podcast Network. And Dan over at Health Podcast will be so happy that you've been on my show. And thank you so much for spending time with us.
Well, thank you so much for having me. It was fun. Thanks, Keith.
Well, there you have it. Thanks for listening to this great episode of the Nurse Keith Show. And remember, the show notes can be found at nursekeith.com/episode 360. If you need personalized holistic career coaching, please look no further than nursekeith.com. Mention Jennifer and get 15% off your first coaching package. Please buy a copy of her book. You can find it on Amazon. The links will be in the show notes at nursekeith.com/episode 360. And as I mentioned, Jennifer's podcast and mine are proud members of the Health Podcast Network at healthpodcastnetwork.com. The Nurse Keith Show is adroitly produced by Rob Johnston of 520R Podcasting, and Mark Cappy-Speeson is our stalwart social media ringmaster. Be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios till next time from snowy Santa Fe, New Mexico. And the inimitable Jennifer George saying adieu from
Windsor, Ontario.
From Windsor, Ontario. Thank you, Jennifer. Thanks so much. Thanks to everyone for listening. And we will catch you on the flip side.